Hi, and welcome to my first vlog for Evoke therapy programs. And what I'd like to talk about tonight is self-esteem. So I've just completed a series of articles on self-esteem for our blog, so I wanted to spend a couple of moments here talking to you about my ideas around the subject. And it starts with my first experience, my first exposure in wilderness therapy almost 20 years ago. And the very first thing that I realized when I was working with these young people in wilderness therapy is that they were so much more resilient than they thought they were, and how they'd convinced their parents they were. They were so much more capable of dealing with things. I saw them to adjust to difficult situations. I saw them thrive in that high level of structure and challenge, and I saw them develop the capacity to learn to feel and to articulate themselves. And this is something that I constantly pass on to parents. And so what I learned in those early days started to teach me something about self-esteem, which really could be traced back to the core of most of our issues, right? How do we see ourselves? How do we think about ourselves? How do we regard ourselves? And one thing I learned from those early days was this ability to do something difficult, to build a sense of efficacy of something that I can do, even to change the locus of control from external, meaning what happens to me defines me, to internal, which means that how I respond to it is what defines me. Having this experience in this raw experiential milieu was something that all of our students and clients walked away with in those early days. I remember noticing that even the children that struggled pretty significantly throughout the program still had at the end of the program that sense of, I did it. I accomplished something. When they came into the program, they were oftentimes characterized by the statements of, I can't do this. I can't hike. I can't be outdoors in the weather. I can't be away from family and friends for this long. And then not only did they adjust to it, they began to thrive in that milieu. And the sense of efficacy and the related sense of positive self-regard were soon to follow after that. So part of what we can do to encourage or facilitate self-esteem in our children is to value the struggle. And to let our children feel difficult feelings. It doesn't mean that we're going to go out there and try to make them feel uncomfortable just for the sake of feeling uncomfortable. But in a lot of ways, we have to just get out of the way. We have to tolerate what I call our empathic misery. When we watch our child struggle, or we watch them go through something upsetting or in pain, we have to learn to tolerate that. To see it in the bigger context and to know that that's okay for them to feel. And provide a safe place for them in this relationship to feel and to express those feelings. So helping them go through the struggle and being able to tolerate that for them helps them to know that it's okay, that I am okay. One common mistake that parents make is believing that they can infuse self-esteem into the child through praise. And not only does that not work, it oftentimes communicates that the parent has a certain idea of the child being fragile. And again, it's not that we don't pay attention to their accomplishments and notice them and comment on them. But when it comes from this anxious energy of, I've got to convince you that you're worthy and lovable, we're not really connecting to the child. We're not really seeing them in their struggle and their pain and their insecurities. And here's something else we know about praise from research, and I'm taking this from Bronson and Merriman's book, Nurture Shock, is that when we praise children on their inherent talents or intelligence or capacities, sometimes we actually cause something to happen that we don't want to happen at all, which is they want to avoid difficult things. In some of their studies, they saw that when they praised students for their accomplishments on certain tasks, those students were more likely in the next activity to choose something easy or were more likely to cheat. So what Bronson and Merriman were able to identify is if we praise the effort, if we praise the child willing to go through the struggle. I can't tell you how many times I've watched a parent watch their child, try to make a Beaudreau fire, which is a difficult task to master and even replicate. And I can't tell you how many times, even when the child didn't accomplish it, the parent was even more impressed and saying, I know you didn't get a fire tonight, but I've never seen you work for something so hard and be so patient and tolerate frustration so much. So when we praise something that the child is in control of, like their effort, their fortitude, their stick-to-itiveness, when we praise something like that, we're actually encouraging characteristics that we want to encourage. When we praise talents, when we praise goodness, when we praise things like that, sometimes It becomes more important for the child to maintain that sense of being on that pedestal, that they're willing, like I said, to avoid difficult tasks or challenges, or even cut some corners to appear to look that way. And another thing that happens is I think parents and sometimes children equate praise with affection and connection, and it's not the same thing. Sometimes when we really lob on the praise to our children, and this idea that it comes from that is equal to praise, then our child doesn't feel connected or loved. They feel objectified. Like, what if I fail? Am I then loved? What if I struggle? What if I have something to share that is I'm really ashamed of? Can I still hold on to, expect that love from you? So we have to be careful about that. For me, the most significant contribution that we can make to our children, and it takes a lot of work on our part, is to connect to them. And although that might sound easy at first blush, it's not. It means that we listen. It means that we tolerate their horrible, rotten selves. That when they're upset, especially at us, we listen to it. That when they're struggling, we don't give them a look on the bright side speech to try to change how they feel. We don't even focus on changing how they feel. We focus on seeing them. We learn to quiet our minds, to open our minds. We don't have rebuttals, justifications, explanations as much as we think we need them, and we just learn to be present. And when we can regard our children without judgment in this way, then they have a sense of, I'm okay. And then the most amazing thing can happen. They then can start to look at parts of themselves that they've pushed down or split off and start to heal them. My own dissertation showed that children that were born into families where there was divorce or alcoholism fared better later in life and in early adulthood with intimacy and relationships if only one thing was present, one mitigating factor, and that was an adult, a stable adult who saw them, who got them. And those that identified that factor, even in the face of some traumas, were able to develop healthier, intimate relationships in young adulthood. So what gets in the way of us encouraging, facilitating self-esteem in our children? Our anxiety and our fear of pain, our own shame. So there's a lot of work we have to do to be able to be a helpful facilitator in self-esteem in our children. We want to control them. We focus on behavioral compliance instead of realizing maybe that behavior, however frightening it might be to me, might be some evidence of some wound that they need to heal. And if I pay attention to that behavior, if that becomes my focus, and if my upsetness around that, my anxiety, my frustration, my disappointment around that is communicated, the child oftentimes is likely to go into a deeper place of hiding, a deeper place of shame. But if I can open it up, if I can manage my feelings, manage my judgments, regard the child with love, understand that they're suffering, even when that behavior is intended to frustrate me, if I can do that, or to the extent that I can do that, I can help them love themselves. Like Jessica Benjamin taught, the great attachment theorist, it is only through another person finding us that we can often find ourselves. The root of the self, she said, goes through another person. So when somebody finds me, when my therapist finds me, can tolerate me, then I can have the courage to look at myself and to see myself. So our task is to learn to be present, to learn to manage our own emotions, our own anxieties, to look into our shame and our fear so that we can be present with them and allow them to struggle, allow them to meet difficulties, sometimes with failure, that we can look at their symptoms or their behavior from a different perspective. I said just the other day on one of the webinars that I broadcast that I have a totally different reaction when I hear about your child cutting, or your child abusing drugs, or your child being depressed and staying in their room at home. I first see that behavior and I think there's some wisdom buried there somewhere, and it's our job to get it. It doesn't frighten me as much as it does you, because they're not my children. I might have those same reactions to my children, and I need to work on that, but it doesn't frighten me with your children. So our work is to uncover the layers of ourself so that we can be more present with our children, that we can regard them, and that we can remember that how we think about our children, not just what we do to them, how we think about our children is how they will think about themselves. So it's more important than what we say or do is how we think about them. And then we give them that, that inner voice later in life that has a more positive voice than some of the critical voices that we end up with in our lives. So I hope it's helpful. I hope the blog is helpful, and have a great day. Bye-bye.